people need to associate their own health immediately when they think of climate change. We know Earth is warming. In fact, June through August 2024 was Earth's hottest season on record. Throughout the year, we've seen extreme heat, heavy rainfall, deadly floods, storms, and raging wildfires across all regions in the world. These events have significant implications for public health. Wildfires and air pollution causes respiratory diseases. Floods cause water or vector-borne diseases. Droughts impact food and water security, not to mention the mental health impacts, as well as the fatalities and injuries caused from these extreme events. As an example, let's focus on India. Delhi had over 50 degrees end of May, which resulted in over 40,000 heat stroke cases reported. Another tragic example from this year in India is the death toll from the landslides that happened in Kerala. And air pollution is a silent killer, causing more than 2 million deaths a year in India. As climate change worsens, the frequency and the severity of these events will also increase. This makes our role as healthcare providers even more critical. We must not only treat the symptoms of these climate-related illnesses, but also address the root causes by actively mitigating our own impact and adapting to the reality that climate change brings. We have to make health the human face of climate change. My third and last point, extremely important. Sustainability is everyone's responsibility. The healthcare industry accounts for nearly 50, well, that would be nearly 5%, nearly 5% of the global carbon footprint, worse than shipping and aviation industries. It's not surprising when you consider how energy intensive our hospitals are. We're open 24/7. We rely on heavily energy intensive machines like the MRI, and just think of the energy needed to run the operating theater. Now I want to take a moment and ask everyone to reflect on how far we've already come in just 2 years since we set our goals. Please take a moment, turn to the person next to you, and give each other a five. I want to see. Next to each other, because everyone had a part to play in this, yeah? Yeah. We should be proud, as we've already achieved quite a bit in such a short time. We have reduced our energy intensity per patient bed day across all our markets. We've started to switch to renewable sources. Gleneagles Hong Kong and 7 IHH Malaysia hospitals already installed solar panels, with all 17 Malaysia hospitals to install by 2026. Our Acıbadem hospitals in Turkey have just signed a solar farm project that will go live in 2026 and generate 80% of Acıbadem's electricity consumption. And Acıbadem has 26 hospitals. In terms of waste, IHH Malaysia and IHH Singapore have reduced single-use virgin plastic in non-clinical areas by over 90%. Remember, microplastics are in everything we eat and drink, and now are even showing up in our blood. Gleneagles India used superior water treatment technology and has saved 70,000 liters of water per day last year. That is 10 Olympic-sized swimming pools. We're also focusing on reducing use of more harmful anesthetic gases across our hospitals. This is just the beginning. There is so much we can and we will do. After all, as my father always reminds me, where there's a will, there's a way. So I want to emphasize that sustainability begins with each of us. It's not only sustainability team's responsibility. Please do not wait for us to push initiatives or put things on balanced scorecard. Experiment, act, and set the best practice for others to follow. As a sustainability professional, as a mother of 2 daughters, and simply as a human, thank you again and again for your time and your dedication to care for the good of our patients, people, public, and planet. I look forward to the insights that will unfold today, and I'm excited to see the collective impact that we will make for generations to come. With hope and gratitude, thank you.
Thank you for setting the tone, Yasemin. And now, I'm happy to introduce Dr. Alexander Thomas, a man whose career is dedicated to the intersection of healthcare and sustainability. As the founder and patron...
Thank you for that kind introduction. And Yasmin, thank you. I think your message came from the heart, and I'm sure it'll make an impact. A lot of things I was going to say you already said, so I'll go through it very... right. Can I have a... It's here? Okay. Sorry. Thank you. Yeah, so I'm going to start on a pessimistic note. I think I'll balance. Yasmin was very cheerful and outgoing. I start on a pessimistic note, but as was said earlier, I think you look at all of, I'm focusing on India, Rajasthan, Delhi, Uttar Pradesh. The numbers speak for themselves. Kerala, you've all heard about the landslides. New Delhi, all over India. Air pollution, and in the south, a huge number of deaths, and these are documented deaths. I think that I'm happy that IHH is actually focusing on this, because as was said, climate change and health sector are very closely interrelated, and it affects each one of us. And I think more importantly, we have a definite responsibility for future generations. So I thought I'd just cover it in these four: understanding climate change, impact of climate change. I'll club these together, and what are our current efforts and future plans, because I want you to know what has been done. It's no point just talking theory. It has been challenging. Now, I think this is an oft-repeated statement that the health sector is a significant contributor to greenhouse gas emissions, and also, I think we need to emphasize this, that's where we come in. It's a very vital part of the solution to mitigate climate change. Again, statements very specific to India. We are 7th in the list of countries most vulnerable to climate change as a global climate risk understanding. So what I thought I'll do today is, I think most of the audiences are going to go to, first they ask me, why are you talking about health and climate change? Taking my own example, I think about 7 years ago, Professor Srinath Reddy had called me and asked me, would you help PHFI set up a unit to work with health and climate change? So my immediate response is, what's the connection? And then when I took on the responsibility and spoke to a few of my colleagues, exactly the same question: what is the relation between health and climate change? And I think if you ask me, probably 90% of healthcare professionals, it's much better than a few years ago, still have very little idea of the relationship between health and climate change. So just a few, I'll just run through this quickly. I think this audience is very aware of these terms, because both Fortis and Gleneagles have been doing a lot of work. If you have any doubts, you can ask me about that. So I won't go through it in too much detail. Climate change, greenhouse gases, carbon footprint, global warming, mitigation, sustainability. If anybody wants any clarifications, please feel free to ask me, but I'm sure all of you are aware of these. This is the Paris Agreement, a landmark agreement where the world in general agreed that we have to do something urgently and immediately. Resilience. Now, again, very briefly, what are the causes of climate change? How does climate change actually, how does it happen? So it's a concentration of greenhouse gases in the atmosphere. It traps the heat, it raises the temperature. That results in melting ice caps, it results in rising sea levels and changing long-term weather points, and this results in heat waves, cold waves, droughts, floods, forest fires, and cyclones. Now, what is the impact? I think this is something that, as healthcare professionals, that we need to spend a little time in. What are the health impacts of climate change? So, I'll spend a little time in each of this. Coming to malnutrition, I think ironically, undernutrition and obesity, two ends of the spectrum, are the leading cause of poor health globally. And the reduced quality and quantity of crops result in increased food and financial insecurities, leading to malnutrition and other problems. I learned something recently, that the rice that was grown about 20 years ago and the rice that's grown today, there is a big difference. Can anybody in the audience tell me what is the difference in terms of nutritional value? The rice grains that is grown globally. So I believe it has only 40% of the nutrients that the grains that were grown just 10 or 20 years ago. And this is as a result of climate change, as a result of water contamination, and this leads to malnutrition. This, I think, was already referred to, but if you look at the figures, it's billions and billions of rupees, and these can actually be significantly addressed. Water contamination, 600 million people are already facing acute water shortage. And I think the second point, I think all of us need to make note of, 40% of the population, or more than 500 people in our country, will have no access to drinking water. And just an example from my own, I live in an apartment complex, and for the last 9 years, we've had no water problem. But the last summer, and this is true of Bangalore where I come from, there's been a huge water scarcity, and we've been having to get water tankers, and we really don't know what is the quality of these water tankers. So I think this is a very, very real problem, and I think all of us need to be aware of this. Heat waves has already been mentioned, and I think all of you have read in the last, especially the last year, many of our cities have had the highest temperatures to date, and these have consequently led to heat strokes and deaths and severe consequences. And please remember, if you don't do anything, these things are going to increase. Vector-borne diseases, as I said, this is something that we really don't talk too much about, but there has been a marked change in vector-borne diseases, in the pattern of vector-borne diseases. This is as a result of the warmer temperatures and changing rainfall. And this is again common news. Malaria, dengue, chikungunya, Japanese encephalitis are all projected to increase. And if you look at the statistics over the last 6 months, especially in India, there's been a significant increase in all these diseases. Microbial threats, again, microbial threats, I think here again is something that we really don't talk too much about when we talk about climate change. COVID was an example. Monkeypox is something which is again now, we are reading about it. And there are many others, rabies, toxoplasmosis, leptospirosis, etc. And unfortunately, India has one of the highest zoonotic disease burdens. And we've had 13 zoonoses which have been the cause of 2.4 billion cases of human disease and 2.2 million deaths. That's a staggering figure. And you look at the deaths, 2.2 million deaths, but you look at the cases and just translate it into the morbidity. Huge amount of sickness, a huge loss of productivity, a huge loss of health. Mental health is another area which we either are not aware or don't talk about because we don't realize. In my experience, I think mental health issues are probably the largest disease burden in India, and largely unrecognized. And depression, anxiety, stress, helplessness, and the last three are all related to sustainability. The terms basically, when you lose your home, you lose your environment, you lose your people. Now, whenever we talk about the population, we always talk about vulnerable population, and I've listed it out here. It's, I think, common knowledge. But these are the people who actually are greatly impacted by climate change. And most of it is self-explanatory. Low-income communities, as always, indigenous people, elderly, the children, women, persons with disabilities, and especially people who are outdoor workers. We are doing a study in Andhra Pradesh, and we have found that people who work outdoors have a very, very high susceptibility to heat waves. I'll talk about that a little later. So now coming to climate change in the health sector. So I thought I'll take a little break before that, and if there are any questions to what I've spoken about. I thought I'll talk a little bit about this book. This is a book called Climate Change and the Health Sector. This was written about 3 years ago. Dr. Srinath Reddy, myself, and a few others. This was probably the first book in India which talks about climate change and the health sector. Now, my job was getting people together. We've got the most eminent authors in the country, and apparently it's being used in many hospitals. In fact, Dr. Karan from Apollo told me that they use it in many of the hospitals, using it as a Bible in how to deal with the health sector and climate change. Interestingly, the genesis of this book is very interesting. We were actually trying to lobby with the government. I'll talk to you a little bit about that, to try and introduce climate change, the subject of climate change and health, into the MBBS and PG curriculum. Little story behind it. Earlier to that, we had brought out a communication book, and that became a communication movement. And after a lot of lobbying with the government, we were able to introduce communication into the curriculum. Looking back, it seems absolutely amazing that this subject of communication wasn't included in the curriculum. Those of you who have studied in the West, you know that unless you pass an exam in communication, you don't get your degree. So, long story short, we got communication in the curriculum, and we thought that we will follow the same thing in the health sector and climate change. We were able to lobby with the government, formed a committee, and this book was actually being prepared as a companion guide for the students. Unfortunately, the committee is still meeting, but we have had to go ahead. So this book actually, I think, has made a big difference. I have learned a lot from this, and this is one of the reasons I've tried to become a champion for change. Very importantly, currently this book is being published by somebody from abroad, very expensive. We're trying to change the publisher, but I think all of you are interested. Please note the link, the open access link. It's available free for everybody. So I leave this on for a little while for you all to take this link. So this is some reviews from some very eminent personalities about the book. One from Ajay Mathur from the Prime Minister's Council, and of course Devi Shetty, who I work with very closely, and Raghu and me have had a long association with Devi. So I think they've given us a very good review on this. So coming to our current efforts and future plans. Any questions about the book and what I've spoken about till now? Okay, so I'll continue, and yes.
Is there any idea of bringing this in smaller bits to the students at school level? Because you are talking about inclusion into MBBS. So somewhere when we are talking about inclusion awareness, I think we should cover somewhere at a school level, very elementary level.
Absolutely. So we are actually trying, we are familiar with the health ministry, so we are trying to get it done there. But I must tell you that we are working with the education ministry. During COVID, we had the opportunity to work with the Ministry of Education. We were able to bring in a module for teachers to identify students with mental health issues. So we're trying through the same sources. But a very important point, I think if you're able to introduce it at the school level, it'll be fantastic. If you're able to introduce it in the UG, PG of medical curriculum, it'll probably reach 2 lakh to 3 lakh students. But if you're able to reach it to schools, it's going to reach millions. So coming to the current efforts and future plans, is just to tell you a little bit about what we have done, and one of the objectives is this, how we can all work together. There's one thing I've realized over the last 40 years working in this area is that many of us work in silos, but if we come together, our outcomes will be far, far better. So this is something that was the Health and Environment Leadership Platform. I said Srinath had asked me to start it some 6 or 7 years ago. Started it, handed over, and then again recently last year he had asked me to help out again. So this, intention of healthcare, the help is that we try and get everybody under one roof. We're willing to work with everybody. Ultimate goal is that how can the health sector be a champion and ensure that instead of causing damage, we go on the other side and promote sustainability. Yeah, this, of course, I'm sure all of you know Srinath Reddy. On the other side is, have any of you heard of Healthcare Without Harm? Yeah, so Healthcare Without Harm. So that's Josh Kalina there and Srinath, and they had roped me into this subject, and now I'll give you details of what we are doing. So this is a little bit about help. These are just a little details about help. It's all available on the net. And objectives, I think the main objective is how can we show leadership in health systems by reducing environment and energy burden, advocate for the importance of intersectoral collaborative policy making, and build capacity of healthcare professionals. Because I think this is one area where we are very weak, the capacity building of healthcare workers. And this, we just finished an exercise, I believe, and this is based on our experience with the three organizations that we were privileged to found, Association of Healthcare Providers, Consortium of Accredited Healthcare Organizations, and the National Board Organizations Association. I believe that if we are together, we can do a lot of things. So what we have just finished a massive exercise where we have identified, as we said earlier, there's a regional steering committee, and under that, we have a champion in each state. We have been able to identify champions, and each state champion has actually formed a committee, and we hope that through this network, we will be able to bring in visibility and be able to help hospitals in their quest for sustainability. I think these are, especially for this audience, I'm sure all of you know this, so I won't go too much into this, that energy is 50% of the healthcare sector's carbon footprint comes from energy, and as was said, we are major polluters. Almost 5% of the carbon footprint is from the health industry. Water, again, facilities are very highly resource intensive, with water being one of the most essential commodities required for many things we do, for infection control, infection prevention, sanitization, sterilization, decontamination, and patient care. And we generate a huge amount of waste, both hazardous and non-hazardous, and a lot of energy is actually spent in treating this to dispose of this waste. Transport, I think it's a given. So many people work in a hospital, the number of vehicles that are used, ambulances, the supply chain delivery. The other area that most hospitals have no idea of, and I think we need to bring in sensitivity, is sustainable procurement, because we have a large number of supplies, from medicines to equipment to a lot of things. So I think these healthcare-related products, it is important that we are aware, that we go into the details and find out how our partners are actually, what are they doing in relation to sustainability. And of course, infrastructure, it's very important that green hospital, as far as possible, we try and become a green hospital. Again, details of that I won't go into now. Energy, some of the things that we can do, solar power, wind energy, bioenergy, hydropower, and LED, etc. Water, I think IHH does it regularly, but we are trying to get the smaller hospitals to be aware of wastage of water, to do water audits, treatment of prevention of contaminants, managing water requirements through bioretention facilities, rainwater cisterns, adequate storage facilities, and maintenance of supply systems. Waste, basic principles, segregation, storage and treatment policies, and sustainable methods to treat biodegradable waste on site, like biomethanation and composting. Plastics, I think you already mentioned, and I'm so happy to hear that IHH as a group is doing so much with regards to plastics. In India, the law has been passed, but the implementation is very poor. So as healthcare providers, I think we need to focus on this, ensure that the use of plastics, single-use plastics, is reduced to a minimum. Actually, for each of these subjects, you can go on talking for us. I just want to have a general all of you to have a general sensitization of what we are doing. transport, again, just some tips on what to do. Procurement, as I said before, a little more detail. We need to go back, analyze the supply chain, identify the carbon hotspots, engage with the suppliers, try and make them also aware that they also need to be part of the effort, because as was said, this applies to all of us, not to any particular group. And having said that, I must say that the government of India has many programs on paper, and it is for us as healthcare providers to try and utilize this. I think all the new hospitals now, again, because of the Government of India policies, these principles are being used, locally outsourced, environment friendly, and designed to optimize available resources. So if working with hospitals and healthcare sector for the last, I've been in the climate change only for the last 10 years. I think the two major issues are, one is awareness. Healthcare providers have very little knowledge of climate change, the health sector, and what to do. And the second problem is, once they become aware, they're not sure how to go about it, how to implement the mechanisms to help in sustainability. So as an organization, and we have tried to sensitize the public, brought out articles in various journals. We are also trying to focus on increasing the capacity of the healthcare providers. These are some of the articles that we have brought out. Recently, this is about 2 months ago, the heat wave advisory, when people were dying, people were having heat strokes, and got a lot of feedback that these tips that these people followed, it has been useful to a large section of the society. We have started, we want to continue to do webinars, roundtables, and YouTube videos, and we'll be very happy to partner with IHH, Fortis, Gleneagles to take this message forward. This is another area where, as health sector leaders, I think we need to focus on, and in this, what we have done is, I've already told you that this book was mainly done for healthcare workers in all areas. It has actually done very well. This was published maybe over 3 years ago, but it's only in the last 18 months that people have started reading this book, because, and that's a good sign, because people are aware. The first National Health Conclave on Climate Change in Health Sector, we did this, I think it was in 2019. So what we did was, we got about 120 experts from different parts of the country. Had a conclave, and you can see some of the leaders here from different parts of the country, the champions. And in fact, we were very encouraged when our Honorable Prime Minister sent us a message of encouragement, and this really boosted our efforts in promoting. Then we've had, through health, we've had 3 regional conclaves. Basically, the objectives of these regional conclaves are to empower healthcare workers, create leaders among them to take the message far and wide. AHPI, that's the Association of Healthcare Providers. I think we were one of the first organizations which came in to brought out these AHPI awards for excellence in healthcare, focused on green hospitals. We actually started this about 4 or 5 years ago. And the other project that we are planning is to come out with a very simple virtual learning platform for healthcare providers first on the climate change and the healthcare sector. This is being, I think it should be ready in about 3 or 4 months. Policy advocacy has been one of the areas, because of our HELP's relationship with AHPI, we have been able to advocate and implement some policy decisions. We were the first, again, AHPI was the first organization, and now we work with HELP, is to come up with green and clean standards for hospitals. We were also able, in the G20 conclave in Goa held a few months, to talk about this, and also the response, there we've got very encouraging response about the book on climate change. This is the letter I was telling you about, where we tried to include this in the curriculum. Unfortunately, it's going slow. We need to try and improve on that, and also try and focus on students. How much time do I have? 5 minutes more. So as a result of the conclave, as a result of the book, we have brought out a book, policy recommendations. All our conclaves, we come out with policy recommendations, and we brought out some recommendations. I'm very happy to say that out of the 10 recommendations to the government and to the other stakeholders, 3 have been accepted, and the rest are in progress. Quickly go through this. Public-private partnership is so very crucial. This is with the government of India. This is with the government of Karnataka. In fact, on the 1st of October, HELP is training all the district medical officers in Karnataka with regard to climate change to sensitize them. This is with the NABH. We're working with them to introduce green standards. This is with ISRO. We're working with ISRO to try and come up with, they work a lot with climate change. This is with the Quality Council, and I must say that the Quality Council has started something called grading of hospitals, which we're going to introduce in a few months. And there a lot of focus is actually on sustainability. These are some of the research projects. They've just started. It'll probably take another 6 months. Collaborations, I won't go. We work with IIT, with all the other organizations. And I thought I'd just end with a song. So just listen to this, and the second part of it, if you could sing along.
हमको है जगना और है समझना, अपनी आंखें खोले और कुछ करे, अभी 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 आओ बनाए एक बेहतर कल, आओ शुरू करे अभी। हमारे ग्रह पर आई समस्या, आओ सुलझाए इससे मिलकर हम, अभी 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 आओ बनाए एक बेहतर कल, आओ शुरू करे अभी। आओ पेड़ उगाए, कचरा हटाए, गलती सुधारे, हाथ बढ़ाए हम, अभी 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 आओ बनाए एक बेहतर कल, आओ शुरू करे अभी। अब देर ना करना, आगे है बढ़ना, धरती सवारे और बचाए हम, अभी 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 आओ बनाए एक बेहतर कल, आओ शुरू करे अभी। We need to wake up.
Oh, I think you can join.
We need to wise up. We need to open our eyes and do it now, now, now. We need to build a better future, and we need to start right now. We're on a planet that has a problem. We gotta solve it, get involved and do it now, now, now. We need to build a better future, and we need to start right now. And we need to start right now. And we need to start right now.
So friends, together we can nurture our planet and our people for a sustainable and resilient future. And we need to start right now. Thank you very much.
Sir, may I request you to step back? I had wanted Yasmin to sort of present you with a little token of our appreciation for being here today. Thank you. No. So may I request that? Can we set it up? I'll do the announcements. And they'll also just take a minute to sort of set up the chairs. So. Healthcare and sustainability are two domains that are inextricably linked when it comes to creating a healthier future for both people and the planet. For our discussion on shaping our future sustainability, Care for Good, our esteemed panelists will discuss the responsibility of healthcare providers in nurturing a climate-resilient future. They are at the forefront of this movement, whether through technology, corporate strategy, or innovative hospital management.
As we're waiting, I just want to say something. Thanks, Dr. Alexander. And I think Healthcare Without Harm is the organization you mentioned. And at IHH Healthcare at group level, we actually have partnership with WWF, as well as very recently, we become a member of Healthcare Without Harm. Now, sometimes after these summits, we forget to take action. And my team is back in Singapore because we watch our carbon footprint. But I will actually ask my team right now who's listening to make sure that we send what Healthcare Without Harm, that's an organization over 3 decades they've been working on and coming up with best practices. There's hundreds of best practices on how to improve sustainability in healthcare. So it's a great resource. When I was talking about sustainability is all of our responsibility. And as you also know, we also have the intranet with Sustainability Intranet page, where it's a great source for all of you to find great information you may be looking for, all the way from the latest Netflix movie to watch, documentary to watch, to the latest news or articles, and etc. So it's also a great resource for you to refer to. Nikita, or shall I just call them? Thanks.
All right, so I would like to invite on stage Ms. Richa Singh Debgupta, the Chief of Strategy and Operations at Fortis Healthcare India, a leader who champions sustainable healthcare practices. Mr. Satish Ramchandani, co-founder of Updapt, whose tech solutions are shaping the future of ESG. Ms. Rachna Panda, VP and Country Group Head, Bayer South Asia, bringing her vast experience in corporate communication and sustainability. Ms. Madhavi Khurana, Chief Administrator at Gleneagles Hospital, Lakrikapul, Hyderabad, whose focus is on driving sustainability at the hospital level. I was going to invite Yasmin onto stage, but she's already here, so thank you for that. Hello. Does that work? Hello? Perfect. No. To you, I think, yeah. Yeah. Hello? No, this is not working. No, this is not working.
We need, wait. Hello? Okay, perfect. Okay, great. First of all, as I was mentioning before, right, diversity is one of our people pillar material matters that we focus on. In the morning, we had all the gentlemen mostly on the stage. So flipped it around, we have only one gentleman and a lot of ladies on the stage now. So I actually want to start by everyone asking you to introduce yourselves. And a quick question, can you share a moment that truly changed your perspective on sustainability? This is it's sort of like the aha moment that made you say, I get it.
Hi, I'm Richa. I'm Chief of Strategy and Operations for Fortis Healthcare Group. I'll also take a minute that, my designation might confuse you that why am I here? Well, I'll take that clue from Yasmin's slide. Her third point was sustainability is everyone's responsibility. And that's the reason I'm here. Now, when ESG in our organization, it started 2 years back, right? And our MD and CEO was looking for who should be handling sustainability, who should be looking at ESG. And then he said, ESG is something which cuts across all the functions, right? And so we need somebody who knows every bit of everything, and that's how it fell under strategy. And 2 years back, I was clueless what I'm supposed to do, what does it mean. Today, I feel I'm much more knowledgeable about that. I'm much more empowered about doing what we need to do within the organization. So that's my introduction. Now, the aha time, or kind of realizing, when I realized that we need to make an impact. So when I was a student, I was doing my master's in hospital administration. So our job was to go to different hospitals and get familiar with the departments. So when I went to biomedical waste management thing, when I was kind of going through that, I was studying that, I realized that the waste that we generate in the hospital, it looked so filthy, it looked so scary, it looked so alarming that if that's not disposed properly, then we are really calling for trouble. And I think we had already called for trouble. So that was my moment that we really need to do something about it. I'll pass it on to you.
Hi everyone, and thanks for having me here. My name is Satish Ramchandani, and I'm one of the co-founders at Updapt. We are an ESG technology company helping medium to large businesses track their ESG data points, performance management, and be more sustainable. We have about 100 plus clients, including in healthcare, about 7 to 8 of them, and it was really pleasing to have them over. In fact, our second client, Apollo Hospitals, was from healthcare about 4 to 5 years back. With regards to the specific question in terms of what made me inclined towards sustainability, I think I'll be very honest, it was by accident. Though I started my career as a governance professional 20 years back when I did my chartered accountancy course. But yeah, I was part of CRISIL ratings about 7, 8 years back, and I got exposed to the entire ESG ratings community, right? And that's how I got inclined towards this space. And last 4 to 5 years, I think pretty excited to see, some of the specific initiatives in the school where both my children are, in various forums when, you see a lot of activity around sustainability. There were 7 students last week who came to my office. They were like aged about 9 to 10 years, and they were speaking about more on global warming. So I think that's very exciting to see this space.
Hi everyone, I'm Rachna. I take care of communications, public affairs, and sustainability at Bayer in the South Asia region. Aha moment would be, in fact I have 2, aha and oho moment. Aha is when I joined Bayer. Over the years I've done sustainability in different formats, but when I joined Bayer, the mission was very, very clear. Health for all, hunger for none. I think it was a very powerful statement, a very purposeful vision to be associated with, and that was my aha moment. The oho moment was when I was detected breast cancer in 2022. Thanks to the Fortis team, my oncologists did a fantastic job. But that is when I actually made this a personal agenda in terms of, when we talk about climate, pollution, plastics, this now is a personal agenda to me. I mean, while I'm grateful that I've could tide over the difficult times, this really has helped me to take the mission to a different level. Today, I really am a voice for cancer, and I drove the B20 agenda on cancer, and that was the time when I was going through the treatment. Frankly, I don't think we realize where we are and the risks of climate change to our health. I think it's really, really time for us to make it a personal agenda. So that's my moment.
Good afternoon, everyone. I am Madhvi. I am the Chief Administrator of Gleneagles Hospital in Hyderabad, LKP. And I think everybody mentioned the aha moment, and I would just want to say that, I have a slightly different perspective on this. For me, there was no particular moment or a day, which sort of changed my perspective towards sustainability, but for me, it was more of the experiences and, the situations that you were put in over the years that changed my perspective. And, I want to share one such situation. Most of the Indian households during Diwali, tend to clean their houses and, decorate their houses and stuff. And, a couple of years ago, when we were, doing the same, we opened up our the store in our house, and we realized that, it was just full. And we ourselves were so overwhelmed and surprised by the amount of stuff that we had hoarded over the years, which included pieces of furniture that were lying there, clothes that were there, cardboard boxes which could probably be used when, we planned to shift the house. So no, we hadn't ever given other thought that, why are we collecting so much? And at that time, as a family, what we thought was that, do we really need all of this? Is it really required? How are we going to use it? We had no plans, but we wanted to still conserve, reuse, recycle, probably, 10 years later. So one was this, and the second was that probably, when we move out of our houses, Yasmin had mentioned the third element, which Richa also sort of alluded to. When we move out of our houses, we don't have the same perspective. We wait for somebody else to take an action, when the collective resources come. So I think for me, this particular situation, along with a lot of other moments or along with a lot of other experiences, sort of, made me more aware and conscious of my actions and the decisions that I take towards sustainable living.
Hello? Okay, it's working. Thanks for that. I think, you definitely touched on a good point. One of the key things in sustainability, it's the biggest threat actually, is the consumerism we have. So let's all of us as individuals think twice before we buy things. Do we really need them? And also think about reusing, recycling, even in our daily lives at home, and of course at work too. So I want to start macro level, and I'm going to have this question to Richa. Because what are the primary environmental impacts of healthcare operations, and what are the key things that Fortis is focusing on to mitigate these impacts?
Thank you, Yasmin. So each individual and each organization is actually impacting the environment. So healthcare is no different. However, what concerns me, and it concerns all of us, is that healthcare, while we are in a business of providing good health, right? We cannot really retain or attain good health in an environment which is not healthy. But the dichotomy is that a lot of things which we do knowingly, unknowingly, is also impacting the environment adversely. So let me give you an example. Few of the key resources which we kind of take from nature, from environment, is water, electricity, and the waste we generate. So let's talk about each of these. Let's talk about electricity. When we look at electricity usage, when you look at a usual office, right? Healthcare per se actually uses 2.6 times more electricity than any other office or any other sector, right? Now let's talk about the water. We all know that in terms of cleanliness, hygiene, this, that, surgeries, we use huge amount of water, and that's almost 3.5 times higher than that any other office use would have. Okay, now look at the waste that we generate. Now the biomedical waste we generate, interestingly, the categories that we have, if we have a quiz here, probably will not be able to name how many types of waste we generate. So it could be chemical, it could be biomedical, it could be biohazardous, it could be pathological, it could be radioactive, right? And now that while I say, I'm sure you can relate it, which department is producing what. So if that's not segregated well, if that's not disposed of well, there is a threat. Moreover that, let me also tell you, all the waste which we produced, 85% is general waste, 15% is actually infected hazardous waste. That needs to be disposed of well. And the cost of disposing that off is almost 10 times more than the usual waste that we dispose of, right? So that's something to ponder upon. Now, something, you know, which got taught to us as well, and my son, who's now in 10th standard, and when he was very young, he actually came, he said that, Mom, we learned something very important today. I said, what was that? So he said, reduce, recycle, reuse. Okay? And I think to reduce the waste production, we always say that these are the fundamental principles which we should apply in our life every day. But interestingly, let's take an example of hospital. Now, hospital, when we talk about OR, which is your operating room, the waste that we produce is, or in the hospital, almost 20 to 30% is produced in the operation theater, right? And there, by law, by following the infection control protocols and things like that, what you have your control over is, and that also to a certain extent, is the reduce part of it. That how much are you consuming? Somewhere, I feel that we have really not looked at it, that when we conduct a surgery, the disposable gowns, the different items that we use, is there an inventory check that needs to be done? Is there a comparison that needs to be drawn across the network, that how much this hospital using, how much another hospital is using, one ortho, if it produces 2 kg, is somebody producing 2.5? And if so, what are the categorization of different waste that we produce? This is the time that we need to think about that, right? So it's very, very important that we do that. Now let me come back as to, at Fortis, what we are doing on few of the things that I have spoken about. First and foremost, electricity. Now, electricity is directly proportional to money, right? So fortunately, we had done a lot about electricity saving because it directly translates into your P&L, EBITDA. It's 2.5% almost of your P&L. That's huge. Even if you save some basis point, it results in a few crore. So we had done a lot, but in spite of that, with Team Together and the workforce that we have in each of the hospitals and support from all the operations head in different hospitals, we were able to reduce 3.5% of electricity. It might sound small, but I guess every small step makes a difference. That's the first point. Talking about the water we have saved across the network, 8.5%. I feel that's significant, right? Now, third thing, biomedical, that's something, as I said, that we need to do something about it. So we've taken our baby steps. What we've started to do is that we have started to draw a comparison. We have a categorization of category A hospital, B hospital, C hospital, purely by the size, right? And we have started to draw a comparison that each hospital, how much waste, biomedical waste they're generating every month. And now this year, we plan to draw the comparison and start looking at it, that can we reduce something? Because recycle, reuse, you can do it only to a certain limit, right? So reduce is something which we are focusing on, and we are quite hopeful that we would have some benchmark soon coming in. It's going to be a little long stretch process, probably a year or two, but then that's something that would be really, really a significant achievement for the organization. So I'll stop here. Thank you.
Thanks so much, Risha. I think it's crucial what you're talking about, right? What we first of all don't have a baseline on, if we don't have the right data, if we do not segregate the waste correctly, obviously we're not going to go far. So we really have to start with the basics and make sure we have the right metrics and the comparisons to be able to make, as such a large organization, right? You know, we have hospitals around the world. We should definitely learn from each other, and we will, and keep moving forward in our sustainability journey. Now, Madhvi, I'm going to jump off to you. So you, in India, have actually experienced directly the impacts of climate change last year in Chengdu. Can you please give your views on the experience you had there? And I have a second question after you give your views.
Sure, Yasmin. So, as most of us are aware, that last year in December, Tamil Nadu was hit by Cyclone Michong. And what followed for the next 36 to 48 hours were torrential rains. And it was the worst that the city of Chennai had experienced in the past 70 to 80 years. And Gleneagles Hospital in Chennai, which is located in Perumbukam, was also severely impacted by the rains and the flooding that happened. And so it all started on 3rd of December with heavy rains. And by 4th of December, early morning, the power was out. There was no electricity in the hospital, and obviously DG backups were available. And gradually by, say, about 10 p.m., the water had started stagnating in the hospital premises. And at that point in time, there were 800 souls in the hospital. So there were about 350 patients in attendance, and the remaining was the staff. And out of these patients, 5 were on life support, so they were on ventilators, and 3 patients had undergone a liver transplant. So the challenge was daunting for the entire staff to give that continuity of care to the patients and also keep them safe. And by about afternoon, so basically what was done, the first step that was done was that every mobile equipment which was there on the ground floor and the patients that were there on the ground floor, they were relocated to the higher floors. And by about afternoon, about 2 p.m., the water had started coming inside the patient areas, which is the IP block, the OP block, and the lift shafts were flooded, and therefore the lifts had to be completely shut down. By about late evening, there was almost 2.5 feet of water, in the hospital on the ground floor. And on 5th of December, which was the third day, over the next 24 hours, the evacuation plan was initiated. So all the patients were screened through, whoever was stable was advised for discharge, and whoever required further care and treatment were referred to the partner hospitals. And considering the water levels that were both inside and outside, on the streets, the only mode of transportation which was available were tractors and were boats. So you can imagine that, how difficult and daunting task it is to, transfer a patient who is on life support through boats and through tractors. So, but that was successfully done, and by 6th of December, almost all the people who were there in the hospital, including the patients, attendants, and the staff, were successfully evacuated from the hospital. And there was no loss of life or casualty, but of course the building and the equipments, there was huge damage and losses, as far as that was concerned.
Thanks so much. So Richa, you covered what we're doing in terms of mitigation, and having experienced firsthand in India, I think adaptation is very, very important in the face of what's coming with climate change. So what are some of the things Gleneagles India is doing in terms of adapting to the climate change? For the next flood, how are you preparing for the next flood that may be coming?
Right, so I'll take this question in 2 parts. One is that how are we preparing for a natural calamity that may occur, again? So, of course, the infrastructure changes have been made. There have been some upgrades to the infrastructure to make, both the building and the premises more resilient to such, disasters and floods, etc. So all the, additional boundary walls have been made. The equipment, whatever could be shifted, has been shifted to the higher floors, and the placement of the equipment, which cannot be shifted, which has to be there on the ground floor, they have been elevated to about 3 to 6 feet. So infrastructure has been relooked at. The second piece is that the disaster preparedness plans and the training of the staff as to how to deal with such calamities has also been sort of strengthened further. Although the team had done a great job in spite of their own family members being in precarious situations where they were stuck with flooding. I would say that they had embodied all the IHH values that we talk about: patients first, empathy, teamwork, integrity, you name it. And we saw it live in action over those 3 days. And so one is that piece. The second piece is that how are we working on reducing the carbon footprint? So a lot of things were covered by you, Yasmin, and a lot of things were covered by Richa as well. And there were a lot of initiatives that were taken earlier, but I think the concerted efforts began 3 years ago. So we started our sustainability journey, Yasmin, with you, with the structured program that you had launched. And So one, of course, is that, like Richa also mentioned, that how do you reduce the electricity consumption. So this is one of the focus that we have, and I'm happy to share with everybody over here that 2022, which was the baseline, from then till now, we have reduced about 6% per patient bed day electricity. So that's, I think, one of the achievements that we, as a company, are very proud of. The second aspect is the use of anesthesia gases. So we've taken up a target of 15%, and we're planning to sort of, reduce the consumption of gases which create more carbon footprint, like desflurane, sevoflurane, isoflurane, with, options like remifentanil and atracurium, etc. So that's the second initiative. And the third initiative, of course, is we saw, both in the beautiful video that Sir had presented and, that Yasmin had shown in her opening remarks presentation as well. So single-use plastics, in non-clinical areas, so we are focusing a lot on that aspect as well, whether it is single-use plastic water bottles or it is the cutlery that is used in, to serve the food, or it is the welcome kits that are given to the patients. So yeah, this is, a synopsis of what we're doing.
Thanks so much. Rachana, I'm going to jump to you now. So Bayer has been on their sustainability journey for over 2 decades. We're quite new. We just started 3 years ago, as Madhvi is also saying, but we're going very far and, very passionately and very determinedly with a clear roadmap. But what are some of the key learnings you can share with us, and what potential pitfalls should we avoid? But of course, you can also touch on some of the focus areas that Bayer is focusing.
Thank you. I think it's very interesting to hear all the interesting work that has been done around sustainability. And even if if you're saying that it's fairly new, but it looks like a lot of effort has gone into it. Bayer is a very, very old company, and 125 years only in India. Right, across the world, it's more than 150 years old. But very interestingly, the mission, as I said, health for all, hunger for none, drives us towards sustainability. A couple of things which really calls out attention is sustainability is linked to the business outcomes. And that's, I think, what drives very interestingly. In fact, all the senior management's compensation is directly linked to sustainability. So we have to drive it. There is no choice for us. There are 3 things that really drives. One is inclusive growth. Second is responsible business operations. And last is the ecological footprint. And we are in the business of agriculture and health, pharma and consumer health as well, right? So agriculture today is the biggest user of water, fresh water. Almost 80% of fresh water in the world is used by agriculture as a sector. So it is our responsibility as well to be able to talk about 2 things: is climate resilient crops, use of reduction of water, and most importantly, nutrition. And I hear all of that in the discussions today. When India got independent, I think we all talked about hunger. But today we talk about calorific value and nutrition. And I think that's a huge responsibility for the sector. But I'm going to focus a little more on the pharma and the health part of it and talk about a few initiatives that we have that I think which will be interesting to the audience. Globally, we have targets of 100 million, reaching out to 100 million women across low and medium income countries by 2030 for self-care and contraception. Reaching out to 100 million smallholder farmers for sustainable and regenerative agriculture. So those are our sustainability targets, and it is tracked almost every year. And all of us drive it in our own areas. In terms of some of the initiatives, today we talk about water resilient rice. I never knew that for 1 kg of rice, production of rice, we use more than 4,000 liters of water. That was shocking. And today we are talking about DSR rice, direct seeded rice, which reduces the consumption of water by almost 25 to 30%. So this is just one example in terms of climate resilient crops that we are talking about. In terms of health, We're very focused on women's health. In fact, we are driving a campaign right now called Preserve the Uterus, which focuses on reduced unjustified hysterectomies so that it is, taken care. And we don't realize sitting in the, metros, but when we go to the farming communities, there are situations when the lead farmer actually makes sure that his labor, women working in the fields actually, remove the uterus because that increases the man hours. That is shocking to know that. So we're right now driving a campaign around that. The second thing we do is around livelihoods and oncology. We train visually challenged women to detect breast cancer through the tactile senses. And now that can be debatable, but in terms of research, that has been proved that it is really quite accurate. And a lot of hospitals have come forward to include this in the health camps. The next thing that we do is right now running sustainability projects in and around Jhajjar, which is a place close to Delhi, with All India Institute of Medical Science in terms of research for prostate cancer. And we're doing some sort of early detection there. With Karkinos, we're doing research around breast cancer and early screening in certain parts of the country. So a lot of work around public health in terms of, detection. Lastly, I want to touch around some social initiatives. At the moment, we have 28 telemedicine centers in the most remotest of locations in the country, which is called the aspirational district, which is identified by the government. 28 of these telemedicine centers connect the PHCs, which is the primary health centers, to the big hospitals so that we can detect as much as possible in terms of NCDs and also critical illnesses. And those are the farming communities. Those are communities who would never be able to come to the bigger hospitals in town, right? So one is that. Second would be, we also work a lot around livelihoods and science, particularly for children and women. So some of these initiatives, there are many more to go, but we're looking for partners. We really would encourage interested parties to come and hold hands in these initiatives. So that's on the initiatives part of it. Your second part of the question is the learnings part, right? What did we learn and what are some of those things that we need to be, I would say pitfalls or challenges. One, I think sustainability should be a part of the business. It cannot stand apart as a social or cause or a social impact piece only. Unless it is a part of the business, it is very difficult to get people with us, right? The second part is, I think, in India, we've taken a special step on reporting, which is, I think, a fantastic initiative by the government, the BRSR reporting. I think some other countries have also done it initially. I just heard about Australia doing some sort of reporting as well. It's interesting to, get into that zone, but I guess we all have to be a little more careful in terms of not just putting it as a checkbox, but the intent and the gravity of the situation should be something that we need to be self-conscious about. So these are two things which I feel we need to be a little conscious.
Thank you for that. And we have very stringent reporting requirements that have just come out actually this week and on Tuesday, because we were listed in Malaysia Stock Exchange, and it's like climbing Mount Everest. But at IHH, we definitely do not see it as a tick-boxing exercise. There's a lot to do, but it's actually is sort of like a crash course on how to run your business better when you follow the requirements. And it's a chance to reflect and rethink and reprioritize. So at IHH, I'm actually quite happy to say, all the way from to the board level to hopefully all the individuals, it is part of our whole DNA now. It is part of the business strategy. We have our 4Ps framework, patients, people, public, planet, that I was mentioning. So I'm glad that we're in sync on what you're saying, that we need to make sure that we succeed in the journey. Satish, lastly, as a technology provider from the tech aspect, what role does technology play in helping companies accelerate their sustainability endeavors?
I think I'll start off with some of the contextual points which many of you guys said, right? Richa, from a perspective of three critical elements around energy, water, waste, and you spoke about the baseline data. Rachna spoke about linking sustainability to business outcomes. Even Alex, some of his points, including various sources of energy, including the renewables, right? Where I'm trying to link is the key is going to be the data, the key is going to be set targets, the key is going to be track performance metrics, right? So this entire data in a scheme of things, whether you are a chain of hospitals with 80 centers, or you're a diagnostic chain with 200 centers, or even a hospital with 3 or 4 sites, right? So data is going to be pretty critical, not only at a site level, but including, it could be at a operating room level. As we know, like 25% of the emissions are from the operation rooms itself, right? And the only way you can really drive performance is to have that granular level of data, including the sources of the energy or the kind of waste, and where the water is going and its efficiency and its effectiveness and a whole lot of other things. So how do you, needless to say, I think technology obviously here is going to play a pretty important role to efficiently track the data points and additionally accurately, not only to enhance the ESG performances, even because if you look at the current ecosystem, yes, you are running a business enterprise. Some of the enterprises may have not-for-profit goals, but you also need to fulfill the requirements. A lot of players of the ecosystem who are seeking these performance points, right? So we do have some of the healthcare clients who probably are not publicly listed, are not needed to report their sustainable performance by virtue of regulations, but they have pressure from the investors, right? In India, again, I think about more than 60% of the companies have, within the healthcare I'm saying, have ESG boards or committees under that, right? You got to, disclose your performance to those stakeholders also. So again, the role of technology, right from data management, reporting, you're digitizing the carbon footprint accounting, becomes extremely important. Needless to say, obviously, there are a lot of other innovation in the tech space, again, within the healthcare sector, right, including the medical equipments and a whole lot of other technical aspects, right, which I'm sure a lot of champions are sitting would realize that the role of climate tech solutions and a lot of innovation in the medical space is extremely important in that direction.
Thank you so much. It says time's up, but can we at least get one question? Is that possible? Is there any burning question any of you have? I know there's probably a lot. Yeah, please.
Yeah, I think IHH and Bay are doing a lot of work, but we have to realize that the big hospitals account for only 5 to 6% of the beds. Is there some way that you can work, Bay can work with help or separately to reach the smaller hospitals, which are the 85% of the beds?
I think maybe I'll just add on a line. It's typically, if you look at non-healthcare also, if you look at SMEs, the small, medium business enterprises, they are the ones who actually account for the larger economic elements and hence the emissions also. But within the healthcare space, obviously, I think the role of government is going to be important. The role of the ecosystem, to me, is going to be important. Maybe in case anyone else wants to share specific inputs on that, I think happy to give.
Yeah, I think, hopefully we'll get to a place, like when I look at, Dr. Pran was talking about it too, like Keith probably next door is talking about Mayo Clinic, Kaiser Permanente. Hopefully what we can do, being one of the largest healthcare networks in the world, is we're new in our journey, we're very focused. And hopefully we can become, in terms of sustainability, the leader that all the small hospitals can look at to see what did they do, what can I follow. Maybe, I look at Francois, right? Like his team in Malaysia, he's country CEO for Malaysia, and like his team is talking about when he was on the plane, he refused to take the plastic bottle, right? So he's being a true leader, walking the talk, and people will follow. He's forcing the hand of the airline, hopefully, to make a change. So if we can really lead, truly lead, inspire, and be a best practice for the smaller ones to follow, maybe that's the right way to go about it. Yeah, please.
I think one of the best ways to do it, like you said, include it in the medical, curriculum. And I was, very impressed with the communication plus, added into the medical curriculum. I must say, right now we are at a point where healthcare, basic healthcare, is also under question in the remotest of locations. This is a good time to explain it to the medical professionals, the healthcare professionals, not just doctors, but even for the hospital management staff, to include it in the training programs and the awareness, and maybe books like yours will really go a long way.
I think maybe
Francois.
just to add on, sorry, the role of government to me is going to be pretty important from designing the SOPs and how do you really, even the smaller hospitals, manage the entire waste management processes and other specific elements.
Francois?
No, just want to make a comment. We have all our colleagues here. Okay, while reducing our carbon footprint at our workplace, at our hospital, of course we have to do it. But the reality is, at the global context, still a drop, right? We know that. We know that healthcare. Doesn't mean, of course, that we shouldn't do it. Of course, it's our responsibility, whether in terms of plastic, reducing our consumables, reducing waste, electricity, all that we do, at least in Malaysia, we try to drive it. But to me, what is more important beyond the number, figure, target that we have is actually the awareness. Because think about it, for every hospital, we have what? 1,000 households. What's the impact if indeed all our employees indeed adopt all these practices? It's actually the way that, at least for Malaysia, I try to approach it. It's not only for what we want to do at the hospital, but my wish is actually for them to truly adopt it in their household. And I can stand up here. I don't know how many people we have here. If we have a 10% that will actually be responsible in terms of reducing consumption, recycling, and reuse, I'm even not sure that the 10% would reach it. Because it's a lot of effort. But once we can increase the awareness with our staff, sure, our impact will be magnified from what we have at the hospital level. So that's what actually the objective that I would say personally I have, increasing the awareness, that probably the same in India. Yeah.
Thank you so much for that, Francois. With that, I think, shared commitment starts with shared understanding for sure, and awareness, and a perfect way to end it. It all starts with each one of you at your homes, and of course in your professional life too. So let's make a difference. Let's keep going in the journey. It's not easy, but we'll learn from each other, hand in hand. We'll keep going forward. Thanks again to the panelists for the great insights and the examples you've shared.
Yasmin, may I request you to present each of our panelists with a little memento?
Yes.
Of today's participation?
Yes, absolutely.
And
I
we'll
was
also
talking
like
to Francois, if next year it's in Quality Summit in Malaysia, it's going to be planting trees, right? Yes. Is one more?
And may I invite Dr. Ashutosh Raghuvanshi to please present a memento to Yasmin. Thank you so much. Now, in order to maintain the sustainability of our session today, I know that we are running behind schedule, but while we are going to break now, I would request all of you to have lunch and come back by 1:45, 1:50. Let's try and do that. A couple of announcements before everybody rushes off. So all of you are aware that we have site visits planned tomorrow afternoon after the agenda. So we're offering site visits to Fortis Hospital, Mulund. We're offering visits to Gleneagle Hospitals, Parel, and of course a Mumbai tour. If you are interested in any of these options, please register yourselves at the registration desk. Yeah? Thank you so much, and we'll see you here at 1:45. Her presentation is titled Reduction of the Carbon Footprint.
Good afternoon, everyone. I'm Christina from Facility Management. Sorry, I start again. Good afternoon, everyone. I'm Christina from Facility Management Services of Prince Court Medical Centre, Malaysia. Before I begin, allow me to share some facts with you. It's actually been said earlier, many times earlier today, that hospitals uses 2.5